Okay, welcome to the normal childbirth module and the presentation on the maternal pelvis. So the first thing is really to think about why is it important that midwives understand about the maternal pelvis and how it can impact on our practice during normal childbirth. Well, the maternal pelvis is important to us for two reasons. Firstly, because it's actually a bony passage through which the fetus has to pass during normal childbirth, and secondly, there are landmarks on the pelvis that we use as part of our assessment when we're assessing progress of labour. So two very important reasons why we need to understand about the maternal pelvis. So when we talk about the pelvis, we talk about two particular aspects of the pelvis. We talk about the pelvic girdle, and we talk about the true pelvis. So I'll quickly just describe what each of these is. The pelvic girdle is actually a basin-shaped cavity which comprises four bones, and these four bones are two innominate bones, and the innominate bone is this area all the way around here. So it's this big bone here, and we've got two of them. We also talk about the sacrum, and we talk about the coccyx. So those four bones together, two innominate bones, a sacrum and a coccyx, make up the pelvic girdle. The other thing that we talk about is the true pelvis, and the true pelvis is particularly relevant to midwifery practice, and it's the bony canal through which the fetus must pass on its journey to being born. And the true pelvis comprises the brim, which is this area here, the cavity, which is the middle part of its passage through the pelvic girdle, and the outlet. Okay, so two different things, the pelvic girdle and the true pelvis. Okay, so what we're going to do is actually go back to the concept of the pelvic girdle, and we're going to be talking about the four bones that make up the pelvic girdle. So the sacrum, as we can see, is the wedge-shaped bone that flares out towards the ala. We can also see as well that the sacrum is the anterior surface of the sacrum, which is the front surface of the sacrum, is concave. Okay, now this concave bit here is also known as the hollow of the sacrum, and it's this part here that's quite significant during childbirth. If we look at the back side, the posterior aspect of the sacrum, we can actually see that it's really quite rough, and it's rough because it allows the muscles to attach to it quite securely to help us in our movement and things. We can see that there's four pairs of holes in the sacrum, and these holes allow the quite major nerves to come from the spinal cord out from the spinal cord and service our lower parts of our body. The coccyx sits